Well, it's World Diabetes Day 2022, and in commemoration of this year's World Diabetes Day, the International Diabetes Federation, IDF, is calling on policymakers to increase access to diabetes education to help improve lives of more than 500 million people living with diabetes worldwide. This year's theme, Access to Diabetes Education, underpins the larger multi-year theme of Access to Care. iBrandTV speaks with Dr. Ikechukwu Okongu, medical practitioner, on access to and need for diabetes education.
Points where education is, absolutely key, especially for developing countries. We have to know there are so many myths around diabetes. We have to educate the populace appropriately well on what the causes of diabetes are, how it can be managed. So I think they are not getting to the point of, we don't need new drugs anymore. We don't need new investigations or new high-tech whatever. What we just need at this point in time is appropriate education to educate the populace, and those who might be suffering from this illness about, the importance of how to make a diagnosis, how to adequately care for yourself, and how to prevent any complications that might arise from diabetes. So I think it's rather key. Generally, education is a problem in Nigeria. I don't know what the stats are, but I know that a lot of Nigerians don't have a reasonable literacy level. So education, not just in diabetes, but in virtually every illness, even as things as little as malaria, education is usually a very big issue. There's the most general myth there is about diabetes is that if you take a lot of sugar, you have diabetes. That's not exactly true. The cause of diabetes is primarily genetic. And so if you have that genetic issue, even if you don't take sugar all your life, you're likely to end up having diabetes. Now, if you take a lot of sugar and you already have that genetic issue, then you're likely to bring it out much earlier. So those who, you can't tell if you have the genetic defect that leads to diabetes. So it's better you cut back on the sugar, but it's not to say that, okay, because you're taking a lot of sugar, you're going to end up with diabetes. As long as you have that genetic defect, you are going to have it. It's just a matter of time. So these are some of the myths that have to start being dispelled, generally amongst Nigerians. Then there are a few others who don't even know what the symptoms of diabetes are. Sometimes because it usually presents with weight loss and polyuria, there's excessive urination. Sometimes they feel it's just because of age, or it's because they have an infection, they take antibiotics and stuff like that. We need to know the trio, the weight loss, the excessive drinking and excessive urination, the trio that is linked to diabetes, or the symptoms that are highly linked to diabetes. So it's important we understand that. Many people don't know that. Then for those who have it, they don't even know what likely complications are. Most of the renal issues, blindness, sores, leg ulcers and stuff like that. So I think there's a lot of education that needs to be done, but we don't have an appropriate body that does that. For a doctor who sits in the office and diagnoses someone, I just give the basic information I need to give. But I think it's time that we have a body that goes around sensitizing people about the symptoms, the complications, and the causes of diabetes. The Ministry of Health, it's about time the Ministry of Health has, there's primary health care already, but, it's just most times on paper. Very few states have very good primary health care. So the Ministry of Health has to ensure that at the primary level, at the community level, people are educated. We have community physicians who their job is to go into the community and educate people on the causes and the ways of preventing certain illnesses. So I think it lies majorly on the Ministry of Health, who will now have their primary healthcare department, go out, with community physicians that go into the inner communities and educate people, on for diabetes in this case, or what causes it, how they can, sort it out, things that they can do to prevent it, preventing obesity, eating right, exercising, and also picking out what the symptoms are very early before it gets very complicated. Then the doctors too have a lot of work to do. I know that lots of doctors are going to defend the profession under a lot of pressure. You work very long hours, you get not very good pay, but even with that tightness and with all that pressure, we should take our time so that once we see someone who is prone to it, or somebody who already has it, we take our time and educate them. I've talked to patients sometimes who tell me that nobody has told me anything. I've been suffering from this illness for so long. They just try to drop for me and I go home. So I think doctors have to be educated. Even if it's not doctors, maybe just, community health workers. It doesn't have to be like somebody who, is a full-time professional. I know that they are community health workers, but because of the state of things in Nigeria, they're not well educated or well paid anymore, so they don't hold on to their jobs. So nurses, community health workers, anytime that somebody comes into a hospital, speaking on the usual media, radio, TVs, just getting people enlightened about what this illness is, what causes it, how it can be prevented, and if you already have it, how it can be treated, and also to avoid complications. So I think it's synergistic. The Ministry of Health has a lot of work to do. Then medical professionals, even the CHU and the community health workers, they have to be trained by the Ministry of Health. I think they have a lot of work to do. And then generally also the Ministry of Information has to go around and educate people. And I think the best time you can educate anyone is when they're in school, because they're gathered together. So, right from secondary school, maybe even primary school, they can be given pamphlets to know, what the common illnesses are and how to prevent it. And they don't forget, once you grow up with that, once you've learned that, you can grow up with it. And, 10, 20 years down the line, you can still remember and then, try to avoid breaking down with those illnesses. In 2015, the WHO, the World Health Organization, came up with a plan or a program on stemming the antimicrobial resistance, which had become quite common. And the thing is, some of for example, penicillin, some of these antibiotics were created in the 70s, some of the ones we use now. And, lots of antibiotics were created then, phenicol, the penicillins and things like that. But very recently, we haven't created a lot of antibiotics. And the antimicrobials are now becoming resistant to the antibiotics that we have. And for now, it takes quite a while, before a new antibiotic comes out, you're talking like 5 to 10 years. While prior to now, like almost every other year, there was a new antibiotic. And so the problem is that, yes, we're having more illnesses, but we're having less drugs to treat them because, the previous ones, the antimicrobials are now resistant to them. And so in 2015, they came up with this plan on getting people aware about this issue. I mean, for them, it's like a serious danger that is ahead of us. Because the worst thing that can happen to you is that that, okay, you have an infection, maybe upper respiratory tract infection. Usually, if you just take maybe amoxicillin, it disappears. But now you take the amoxicillin, it's not like you bought a fake brand, bought an original brand, you take it for the amount of time you're supposed to take it, and still nothing happens because that antimicrobial that is causing it is not resistant. It's a very big deal, and it's very concerning because we are not producing enough antibiotics. So what we are trying to do is making sure that those that we have available are still functional and they last for a very long time. And so that's why they basically came up with it. It's something that is quite concerning. I was in a conference, an online conference anyway, and we had some speakers from the US, and they asked us a question that, is it true that there are antibiotics in the rain in Africa? What that means is that, it's so easy to get antibiotics that if it rains, antibiotics fall. In developed nations, it's very difficult to get antibiotics. I know from personal experience in the UK, in the US, you just don't walk across the counter and get antibiotics. It's very, very regulated. It has to be signed by a doctor who puts in his registration number, and it doesn't give you for a very long period of time, maybe just 5 days to 1 week. In Nigeria, I'm sure you know personally that not even pharmacists, even chemists have antibiotics. If you want amoxicillin or augmentin, in fact, they know it. In fact, some hawkers even carry antibiotics. It's very easy to get it. And this is what actually causes it, because this is how it goes. You have an infection. You start treating it, you take it for maybe 1 or 2 days, and then because you're fine, you just stop taking it. And then you haven't completely cleared the microbes that cause this illness. And then they'll start mutating so that they can, survive. Or it's just like, for example, you stab someone with a knife, but you didn't kill him. Next time you want to come and stab him with a knife, you obviously have learned a lot of skills so that you can avoid dying because he has survived, a knife attack. And that's what these antimicrobials do, basically. And it's a problem in developed nations, or developing nations rather, Africa. I think it's also a problem in India because there's very poor regulation. Developed nations have regulated theirs so well that you can't just walk across the counter and get an antibiotic. It doesn't matter, even if it's just one dose. Most of them have to be gotten in hospitals, or if you're going to get it from a pharmacy, and the doctor has to sign it out for you before you can get it, and it's not given for long. And so, to an extent, they've stemmed that antimicrobial resistance significantly. But we still have the issue of, people, the world is an open space now. I can fly from Nigeria to UK or US, and then I carry those bugs from Nigeria over there. and then, I can spread it to other people around. So it's a major issue because it's not just that, okay, fine, US or Europe has gotten theirs right. Anybody can fly in from India or from Africa and spread those microbes to those that are there and then still cause antimicrobial resistance. So for them, they set up laws that has reduced it. But for Africa, we haven't quite gotten it right yet. It's still something that is, antibiotics are very open to get. They are easily abused. Anybody has any mild infection, they can start taking antibiotics. Some of these illnesses are viral, so the antibiotic you're taking is just a waste of time. Give the infection to for every headache, we take antibiotics. And that has now made these microbes, a lot more resistant to the effect of these antimicrobials. So I think prescription-only medicines, I know it's going to be difficult, but we have to get to the point where I think the Pharmaceutical Council of Nigeria, PCN, they have to take the bull by the horn. So if you're going to open a pharmacy, I know it's going to be very difficult, even for me, because many times if I just have an illness or maybe somebody around me has an illness, I just can't get an antibiotic. But it has to get to that point where we say pharmacies don't sell antibiotics until you see a prescription. It has been done for certain drugs like, the opioids, tramadol, morphine. You just can't go, or codeine. You can't just go by the counter and get those ones because it's the law. If you do that, your pharmacy is closed. So I think it's just a simple law by the National Assembly can do this and say, okay, before you get an antibiotic, or maybe even if we are so benevolent, we can say, okay, don't sell for more than a dose that is more than 3 days, to anybody. Or just find a way to just regulate this use of those antibiotics. And then once again, education, we have to educate people that, look, it's not every single thing that you take antibiotics for. There's this thing that goes on. If somebody has malaria, they add ciproflox to it because they believe that there's malaria and typhoid must go together. That's not necessarily true. And if they have a little bit of abdominal pain, they take antibiotics. If they have diarrhea, they take flagyl. Most of these things are self-limiting. Within the 24-hour period, they're going to just get cleared. So we have to re-educate the populace. We have to set in laws that stop the misuse of antibiotics, and, educate people that, you don't have to always take antibiotics and that this is a real problem. It might get to the point, even for individuals sometimes, maybe when you have abused antibiotics so much, you get to the point where when you're now very sick, you're taken to the hospital, no matter the antibiotic you're given, it doesn't work. And that now becomes a real issue for whoever has abused those antibiotics. So I think we have to also understand that it's affecting us negatively on an individual level, not just the continent, not just Africa, but individually. For me, I don't just go around prescribing antibiotics because I know that when this person needs this antibiotic, it's better that he hasn't been exposed to it so that there's a very low possibility of antimicrobial resistance or microbial resistance. So we have to re-educate the populace. We have to set up laws that limit the use of antibiotics or limit, make antibiotics prescription-only medicines. That's about the only way we're going to be able to go through this.